You've been wondering what the difference between upper cervical chiropractic is and traditional chiropractic. That's what we're going to be covering in this video. We're going to talk about what makes upper cervical different, why this area of the neck is so important, and how upper cervical chiropractic might be able to help you if other traditional chiropractic methods haven't. Let's jump into it. So the difference between upper cervical chiropractic and other chiropractic techniques, that's what we're talking about today. So we're going to talk about the differences and we're going to break down what makes upper cervical different and why this area of the neck is so important. So the upper cervical area, for those of you who don't know, is the top two bones in the neck, which is C1 and C2, or the atlas and the axis. So this portion of the spine is the most freely movable in the whole spine, so it's most likely to get injured whenever we have any kind of head or neck trauma. So, long story short, we're going to talk about whether or not upper cervical can help you with your health conditions if other chiropractic techniques haven't. Because I know that's why most of you are here today. You want to know if upper cervical can help you. So, I want to start off by saying that there are a lot of different chiropractic techniques. Some work better for others, and there's many different reasons for that. This is not to say that upper cervical is better than all of those techniques or that any technique is better than another. They all have their place, but not every technique works for everyone. Upper cervical isn't for everyone. We want to make sure that each patient gets their own unique care with whatever technique that works best for them. So I've actually experienced this firsthand. So I fractured my back about 8 years ago and had severe low back pain. I fractured L4 and I had a bulging disc from this, and it was not a fun time in my life. I was very young playing basketball, and I went to multiple different chiropractors, and some kind of helped, others made me worse, and then others really helped. And the ones that really helped are why I'm here today and why I am a chiropractor. And it's what got me into chiropractic because it helped me and it got me back to playing basketball and being able to function again, and I'm so grateful for that. But let's highlight some of the key differences. So the main difference in upper cervical and other techniques is that in order to do specific upper cervical, is the chiropractor must take imaging of the upper neck. That's the top two bones called the. It's also called the cranio-cervical junction. So that's the head neck junction. So they must take imaging of it. So there's a lot of chiropractors out there that will adjust the upper cervical spine, but they're not going to take imaging of it. So imaging is something like an X-ray, a CBCT, or even an MRI. So these are the ones that are the most commonly used. So the imaging is first used to make sure there are no gross pathologies and that it's safe to adjust you. But upper cervical also use this imaging to see exactly how they're going to adjust you. So that's what makes a big difference. We don't go based off of our palpation. So palpation is, using our hands to feel where the bones are restricted. We're using the imaging to see exactly how the bones misaligned to know how to adjust you and correct that. So, like I said, not all chiropractors use imaging. There's some that do, but they don't use the imaging to know how to adjust you. They use it to see if there's any sort of pathology or fracture or anything like that. There are some others that do other techniques. One of them is the Gonstead technique. Gonstead chiropractors will use imaging in the same way. They also use palpation in other different analysis procedures, but they will use imaging to know how the bones misaligned. But again, it's just a little bit different method, and they're adjusting the full spine as well. Um, I talked about, using imaging like this allows us to see specifically how the joints are lining up and exactly how the head is sitting on the neck. So I alluded to this earlier. This area is the most movable in the spine, and therefore it's the most susceptible to injury. So this is one of the reasons we always want to take imaging of the craniocervical junction before we adjust it. We want to make sure we're adjusting in the direction that the bones are misaligned. So I also want to be clear in this that we're not just taking imaging of anyone and everyone. We only want to take imaging if your history dictates that is what you need. Not every single person needs imaging of their upper cervical spine. Some people haven't had any injuries or any traumas, and that just means the upper cervical is not the best fit for you. If you have specific symptoms going on, you've had injuries in the past, even a long time ago, that is something that would dictate that you need imaging. And also, our physical exam is also what tells us whether or not you need imaging. Every person is different. Not anyone and everyone just gets imaging of the spine. So in that case, when you don't need imaging, you could be referred out to another provider that could help you with whatever condition it is or symptom that you're having. So another key difference in upper cervical and other traditional chiropractic techniques is that most of the time there's no sort of twisting, cracking, or popping of the neck. So a lot of people out there are worried about getting their neck cracked by a chiropractor and they're scared of it and they don't want to do that. And like I said, there different techniques work for different people. There's some people that do really great with that and they love it and they do well, and there's others that don't and that their body doesn't respond to it as well and they don't like it. So within upper cervical, we don't do any twisting, cracking, or popping of the neck. So this area is very delicate. So like I said, it can be injured. So most upper cervical chiropractors will adjust you very gently, and sometimes they'll use their hands. Other times they'll use an instrument. Um, the instrument it uses a vectored force to deliver the adjustment. So you're laying on your side, and like a stylus will like contact you here on the top bone in the neck and deliver the force. Um, and those are all great. So some will even use a combination of these adjustments and analyses because not one technique, even within upper cervical, is right for everyone. We must find out what your body best responds to and how we can best reduce the misalignment and also help you reach your health goals. That's the ultimate goal in this is we want to help you and what you're struggling with, whether it's migraines, headaches, face pain, neck pain, post-concussion syndrome. Those are some of the common symptoms and conditions that upper cervical chiropractors can help with. There's more than that, but those are those are some of the most common ones. Let's talk about why this area is so important. So I've stated this again, it's the most freely movable joint in the spine, and what that makes it the most susceptible to injury. So anytime you have an injury to the head, you have an injury to the neck. It's almost impossible not to injure the head without injuring the neck. This could be something like a whiplash event and concussions. Those are some of the most common. But really, when we're talking about this area, it's not the bones, it's not the atlas, and it's not the axis that make this area so important. It's actually the soft tissue structures that are surrounding it and within it that make it so important. So we're going to talk about some of those soft tissue structures that are surrounding it. I want to emphasize this isn't an exhaustive list, and it's just some of the highlights. We're only going to talk about a few of them in this video. In the future, we're going to be going over more of what makes the upper cervical area so important and all the soft tissue structures that are surrounding it. So we're just going to talk about two of them today, and both of these actually have to do with blood flow. So on the left here, you'll see this is the upper cervical spine. So you have the base of the skull here, the top bone in the neck that's sitting right here, and then the second bone, third bone, fourth bone. So what we want to talk about in this is the vertebral artery. So this artery you'll see starts down here, goes all the way up through the cervical spine, and then goes through this top bone in the neck. So this is the outer portion of the top bone. There's a little hole here that it goes through, and then makes almost a 90-degree turn, almost another 90-degree turn to go up into the skull where it feeds blood to the back portion of the brain. So this artery is very important because, like I said, it supplies blood to a lot of the back of the brain. And whenever there's a misalignment up here at this artery, it can cause a distortion in that, and it can end up affecting many different things. Like I said, some of the most common symptoms we see that can be affected there. So that's a super important artery. That's why we also want to be so delicate and so gentle whenever we're adjusting this area. And then the second one here you can see is the internal jugular vein. So the internal jugular vein, so you'll see just to get us in the right position, this is the head, and the top bone in the neck is sitting here, and the second bone in the neck is sitting right here. So right in front of this top bone, right there where the top of that arrow is pointing, is the internal jugular vein. So the internal jugular vein is what drains the brain of blood. So this happens all the time. It happens a lot while we're sleeping, but this is something that's happening all the time because the brain is constantly getting new blood pushed to it, so blood has to be pushed back out. Now, whenever this bone misaligns, it can close one of the internal jugular veins, and that can end up causing many different symptoms. And I do want to say that it doesn't always have to cause symptoms. There are some people where this vein can actually be closed on one side or another because of genetic variants, and it's completely normal for that person and it doesn't cause any harm. But in some situations, we have to be diligent with our case history, our exam, and our imaging. You'd see both of these on an MRI to know whether or not they're being affected by a misalignment up here. So we always want to be diligent in doing case history to know if these are contributing to the patient's symptoms or condition. So there's a couple studies here that reference how these two are affected. And these studies also talk about the role of cerebrospinal fluid flow. Um, I'll put the links for those down in the underneath this video. There's still many ligaments, muscles that are all affected when this area gets misaligned. And I also want to emphasize that this evidence is emerging, so we still have a long ways to go to know the full effects of a misalignment at the craniocervical junction. So if you're struggling with any symptoms like migraines, neck pain, facial pain, post-concussion syndrome, and other ailments of the head and neck, going to see an upper cervical chiropractor could potentially help with what you have going on, especially if you've already seen other chiropractors and they provided you some relief, but it didn't fully help, or maybe you're scared about getting your neck twisted, cracked, or popped. That would be another reason you could go see an upper cervical chiropractor, because most of the time they're not going to do anything like that. They're going to be very light, gentle, and specific in how they're adjusting you. Again, that doesn't mean that traditional chiropractic is bad. There is a time and place where it helps a ton of people. It helped me. It's helped so many other people, and I know that it's great and it works. But this is just what upper cervical chiropractors do and what they're focusing on. Um, so if you've had any sort of head or neck trauma, whiplash, concussion event, and you're still struggling with those symptoms months and months later, comment down below the area of your town where you are to see if we can find an upper cervical chiropractor near you to see if they might be able to help with what you have going on.